Hi, I'm going to talk to you today about side effects of biologic medications. The first side effect that you hear about with biologic medications are serious infections. And while the medications themselves are probably not the thing that causes the infection, they are, however, a hindrance to you fighting off the infection. I hope that makes sense. So, because they alter your immune system and your natural ability to fight off an infection. So, the one thing that we are very careful about making sure people know is that should they get an infection, to let us know right away so we can get them started on an antibiotic. In a later video, I will review what infection may look like in you. The next thing that we're careful about is hepatitis B reactivation. So if you've had hepatitis B, it's important that we know. Although for the most part, we will do blood work to make sure that you have not been exposed and that you do not have active hepatitis B at any point in your treatment. The next thing that you may hear about as far as a side effect would be an allergic reaction. And these reactions are probably going to be different depending on the way that you receive your drug. So if your drug is given by an IV infusion, where you go to an infusion center and there's a needle put in your vein and the drug is administered through that needle, the allergic reaction or reaction is going to be a little different. You may have shortness of breath, you may have chills, you may have redness, you may have itchiness, itchy eyes, itchy lips. You need to let your nurse know immediately if you have any of those symptoms. Then more than likely the nurse will slow down the infusion and give you something to counteract that reaction. If, however, you're taking your medication by an injection, your reaction that you may see may just be a reaction at the site where the needle punctures the skin. You could get a hive type looking area around where you've had the injection. It could be red, it could be a rash, it could be an itchy spot. It could get warm and tender. All of those things could be signs of an allergic reaction, along with a full body rash and that kind of thing. So just make sure that you would let your provider know that that's happening whenever you're giving yourself an injection. The next thing as far as side effects, and these are not common side effects, but anyway, side effects that you should be aware of, it is sort of nervous system disorders. So if you suddenly would have any trouble with your vision, if you have numbness and tingling that you've never had before, those are important signs of a nervous central nervous system disorder. So you would want to call your provider should any of that happen. The next thing is there could be an exacerbation or a sudden onset of heart failure. If you would have sudden sort of swelling of the ankles, shortness of breath, swelling of the hands, again, let your provider know that that has happened, and we can take a look at the medication and see if that could possibly be the culprit. There are some medications that if you have COPD, it could get a little worse while you're on the medication. Again, we need to have a very good medical history on you, and we would watch out for that. Other areas of side effects could just include a lupus-like syndrome, which is another immune system disorder that we have sometimes seen with the category of medications called TNF inhibitors. If you should develop a rash across your face, on your arms, and that rash gets worse in the sun, along with joint and body pain that you never had before, this could be signs of a lupus-like syndrome. And again, you would please let us know. So any questions about side effects, while they are not common, they still could creep up, and it's important that you know what to look for to stop any long-term side effects from happening. So just call your provider if you have any questions about these. Thanks.